Hello, my name is Jim Kulikowski, and I'm a practitioner of traditional Chinese medicine, Ayurveda, an acupuncturist, as well as a practitioner of Qigong and yoga. And in this short video, I'm going to show you some very simple ways to stimulate your immunity using acupuncture points, or as they're called, marma points in yoga, and a simple yoga exercise for immunity. So to begin, I just want to explain to you a little bit about the immunity. In traditional Chinese medicine, your immune system is part of the lung and large intestine system. The lung and large intestine system includes any part of the body that interfaces between the inside and the outside. For example, the lungs, the large intestine, the skin, right? The sinuses, the throat, the nose, and the immune system. And you can think that the immune system is actually what guards our inside from external pathogens. So in this case, we're strengthening the lung and large intestine system in a manner that actually stimulates the functioning of the immune system. So to begin, I want you to just take a moment. You can sit or stand, whatever's comfortable for you, and just close your eyes. And as you close your eyes, just take a couple of breaths in and out through your nose or mouth if that's more comfortable. But I want you to get aware of how deeply you can breathe and what your capacity for breath is. How open do your lungs feel or not open? And don't worry if you don't notice anything. You'll notice something after we do the points. I just have you do that to see the difference in how your lungs feel before and after. So the first point we're going to find is on your breastbone. So locate your breastbone, and if you slide your hand down to about the fourth intercostal space, or in men that's generally in line with the nipple, some women you'll find that too, but you're going to feel a little sore spot. It's a little more than 2/3 of the way down the sternum, and I want you to just stimulate that spot. Don't worry if you're in the exact right point. As long as you're somewhere near, you'll be doing the job. But one way to tell if you're in the right place is, in most people, this point will be a little sore. And some people also, you'll feel a little indentation in the bone itself where the point is, or some different shape in that point. So giving yourself a good stimulation, feel free to do this as long as you want. This point is also a very good point for calming the mind and for anxiety. So the next point, there's actually two of them, there's one on each side, are on the lung channel, the next set of points. And to find these points, you're just going to locate your clavicle, your collarbone, and go right below it. So the space between your clavicle and rib. And I want you to just walk your fingers outward laterally from the sternum until you reach sort of an indentation. It's pretty easy to find. An indentation where your pectoralis muscle, your chest, and your deltoid, your shoulder, and the clavicle all sort of meet. There's a kind of a sharp indentation there. And I just like to take 3 fingers and on each side find that point and dig. Again, this point on some people is going to be a little sore. So take it easy, go whatever's comfortable. If it feels good to give it a lot of pressure, go ahead. As you're doing this point, you can revisit the idea of closing your eyes and taking a few deep breaths, just seeing how, if any, your lung capacity has changed. And generally you'll notice that your lungs will start to feel a little more open and you feel like you can breathe a little bit deeper pretty quickly. So take your time, but give this a good stimulation. This is lung 1 and 2. It's actually 2 points we're stimulating. So after you've done that for a while, and you feel like it's time to move on, we're going to find the next point, which is called lung 5. So if you find the crease of your elbow, right, the inner crease, you're going to find if you put your finger in the center between the 2 tendons, right, you're going to feel 2 tendons, and you're going to go just laterally, right, towards the outer tendon. If you push up against where the tendon kind of meets the center part of the elbow, you're going to again find, most likely, and most people, are not necessarily everyone, but a sore spot. So I want you to just I like to use my thumb and just dig in. And again, you can do the sitting or standing. Be sure you do both arms because the channel occurs on both sides. And as you do it, take your time, breathe in and out. See if notice your breathing. Notice if the capacity for breath has changed. Also, if you happen to notice that one side is more sore than the other, I recommend favoring that side. It's a little more in need of the attention. So again, this is lung 5, and take your time, give it a good stimulation, and then we'll move on to the next point. The next point's a really important point. The next 2 points are because they specifically are said to what's called in traditional Chinese medicine, release the exterior, meaning they stimulate the immune system on the exterior of the body to push out pathogens. So they're great points to use to prevent getting sick as well as if you do contract some kind of pathogen. The first point is called lung 7. And if you find your thumb, this is on the radial side of the wrist, and you slide your finger up, you're going to find a bone just right proximal to the crease of the wrist. In other words, towards your body from the crease of the wrist. And this bone is your radius. And on the head of that bone, you're going to just slide your thumb back a little bit. You're going to feel 2 tendons, like a little notch between them on the side of the wrist. So go ahead and just dig in there. And again, most people find that this spot is sore. I don't personally, but most people do. So give it a good stimulation. Again, you'll know if you're on the right spot because you'll see the head of the radius, the head of that bone. And if you go just towards your body from it, where it curves in, you're going to find almost like a little plain area between 2 tendons. So give that area a good stimulation. Again, monitor your breathing. Notice if you find a deeper capacity for breathing. Some people also find when they stimulate this point, it feels a little zingy. That's normal as well. So the next point is actually on the large intestine channel, and it's nearby the one we just did, lung 7. This is large intestine 4. And basically what you're going to do is find your index finger and slide one of your fingers up until you find the metacarpal bone, the bone that's right behind the finger. And what you're going to do is just in the very center of the bone, if that's the size of the bone, in the center, if you dig around, most likely you're going to find a slight indentation in the bone as well as a sore spot or a zingy spot. If you look at where it is, it's kind of on the webbing of the index finger and thumb, but right up against the bone. And what you're going to do is push against the bone to stimulate that spot. And again, most people find this is sore. It's rare that I don't find people who feel sore here, or soreness or zinginess. If you don't feel anything, as long as you're in the right area, you're fine, but just know that not everybody feels sore there. So again, be sure to do both sides. And again, this point is said to, along with the previous one, release the exterior. In other words, it stimulates the immune system, opens it up and pushes out pathogens. So the next and last point is also on the large intestine channel. And we found lung 5 before, just on this outer tendon, or inside of this outer tendon. But if we took the distance on the side of the arm between the point of the elbow and the crease, if we go halfway and just dig your thumb in there, you're going to find another most likely sore spot. So I can just go ahead and dig in there for a moment. Again, some people find it's not sore, but most people will. And be sure you do both sides. And feel free to pause the video if you want to spend extra time on any of these spots, especially if they're sore. I recommend giving them a little bit of extra attention. Also, go ahead and monitor your breathing, especially these last 2 points. If you have closed sinuses, they may actually open them up and help you breathe from this area deeper. The large intestine channel runs all the way up into the nose. So once you've completed those, and feel free to do them a second time if you like, I recommend adding this next exercise a couple of times. So to do the exercise, you're just going to stand with your feet hip width apart and make sure your feet face directly forward, not turned out, just directly forward. You're just going to balance equally between both feet. Take a moment, relax there. Once you find it, you're going to interlace your fingers behind your back, and I'm just turning to the side for demonstration purposes. So you're just going to interlace your fingers, and I want you to just take a few breaths and imagine you're breathing all the way down to your arms, all the way down to your hands, as if your arms are hollow, into those channels we just activated. And as you do that, I want you to reach the crown of the head up so the spine gets nice and long. You're not sinking into your neck, you're getting longer. Try to squeeze your shoulder blades back together and try to lift your arms higher and higher. I'm going to take about 5 or 6 breaths here. Again, breathing deeply all the way into the chest and down to the hands. As you're doing this, imagine you're finding the crease or the pit of the elbow and turn them outward, away from the side of the body. And you're just going to turn outward, and you'll feel your shoulders kind of squeeze together naturally a little bit more. After about 5 or 6 breaths and lifting your arms high, you're going to tip forward from your pelvis and just let your neck and head hang
As you do so, stretch your arms as far as they could go over the head and just hang here for a moment. Now, I know you probably can't see me on the video, but just try it. Just let your back relax, pull your arms farther over the head, soften your neck, and again, take about 5 or 6 breaths. And you can imagine breathing all the way to your hands and wrists. And once you finish that, just relax your hands and let them hang towards the floor. Doesn't matter how flexible you are, just let your hands hang and just notice where you might feel a stretch, or notice how your body feels. After a few breaths there, just come back up and repeat that pose again. So you can do that pose a few times. You may notice after those points in that pose, you have a much greater capacity for breathing. You may also notice you feel a little bit more energized and your posture feels a little different. So practice that, take your time, master it, and feel free, if you like the video, to hit the like button and subscribe for more videos on health, healing, spirituality, etc. Until then, namaste. I wish you peace.